So my presentation is on tonsils and tonsillectomies. So before we get into the tonsils and tonsillectomies, it is important to understand the anatomical structure of the tonsils as well as what system is involved with. So it's the lymphatic system. The lymphatic system helps move and drain body fluid and fight infection. The lymphatic system consists of three things: lymphatic tissue, and multiple structures and organs which contain lymphatic tissue and red bone marrow. On a quick side note, as we know, red bone marrow is a key component of the skeletal system where blood cells are made. So already we have the connection between lymphatic and skeletal systems. Now I'm going to break down the lymphatic system. Lymphatic tissue is the first part of the system. It is a type of connective tissue that contains large number of lymphocytes. Lymphocytes are a form of small white blood cells that contain cell containing a nucleus. Inside the lymphatic tissue is a type of fluid called lymph. The lymph fluid is very much connected to the circulatory system because it deals with blood plasma, which, as you remember, is the actual fluid component in blood, making up around 55% of blood. Lymph is created when blood plasma is filtered out of the blood capillary walls. Once it is filtered, it takes form as interstitial fluid, which surrounds the cell tissue. Then this interstitial fluid passes through the lymphatic vessels, which then become lymph fluid. What's important to understand about the lymph fluid is that it is chemically similar to plasma, but it contains less protein, and around 20 liters of the lymph fluid filters from the blood into these tissue spaces every single day. So then lymphatic structures and lymph nodes. Lymph nodes are what takes form when the lymphatic tissue and the lymph are combined. The nodes are bean or oval shaped and are scattered throughout the entire body. And an average human has anywhere from 500 to 1,500 lymph nodes. Anatomically, this is what a lymph looks like. A lymph node. It's heavily concentrated with lymph. It's surrounded and protected by a capsule of dense connective tissue, which is the green part, and plasma and T cells are what fight infection, go in and out of the nodes, which are then released to circulate around the body. Now that we know the basics, we can get into what a tonsil is. And quoted from our textbook, a tonsil is an aggregation of lymphatic nodules embedded in the mucous membrane of the throat. To simplify that, they are lymph nodes in the throat. Contrary to popular belief, humans have not just 2 tonsils, but 5 tonsils around their mouth and throat areas. All of the tonsils form a ring at the junction of the oral cavity, nasal cavity, and throat cavity. All 5 are strategically placed through evolution to fight off disease or any foreign invaders that may enter the body orally. In addition, all tonsils participate in immune responses, and while the tonsils aren't vital for survival, they are the first defense against infection in the immune system. So next is talking about the types of tonsils. The first is the pharyngeal tonsils, or more commonly known as the adenoid, and this is one tonsil that is located in the upper part of the throat and embedded within it. There are 2 lingual tonsils, which are located at the base of your tongue, and when you lift up your tongue, you can see them. And lastly, there are 2 palatine tonsils, which lie at the back of the mouth. These are the tonsils that are most familiar to us because in the majority of tonsillectomies, the palatines are the ones that are removed. A tonsillectomy, like I said before, is performed most commonly on palatine and pharyngeal tonsils. The definition of a tonsillectomy is basically an invasive surgical removal of tonsils. Tonsillectomies have been performed in order to treat tonsillitis, sleep problems, including sleep apnea and snoring, and it's also performed to treat breathing problems out of the nose and or out of the mouth. So what is tonsillitis? I talked about that. That's a very key factor that results in tonsillectomy. So the problem is more common in children because the tonsils in relation to the immune system are significantly more active before puberty. With tonsillitis, the tonsils themselves become very susceptible and vulnerable to infection. This is because tonsils are the first line of defense for the immune system, and in children, immunity is not as strong. Therefore, the tonsils are weakened and can easily become inflamed or infected. From this, sickness becomes more frequent, and the patient knows that a tonsillectomy is necessary, especially when they're treated with antibiotics, but then the antibiotics no longer are doing their job. So the patient is admitted to the hospital after a conversation and consultation with a doctor and is prepared for the surgery. What happens in the actual surgery is the patient is sedated under general anesthesia. From there, the surgeon isolates one tonsil at a time using a grabbing-like tool called a tenaculum. So it grabs it. The surgeon will then use a cautery device to cut the tonsil. And as a result, the wound begins to bleed profusely due to the chopping of the blood vessel. And it'll go, you get a closer look at what the blood vessels look like now that they're like cut drastically. And to cauterize or stop the bleeding, surgeons use radio frequency energy, which seizes the blood and forms a scab through the cauterization of the actual blood vessels that were cut. So, and there's the scab that has become clear. So, there are always complications with surgery. During surgery, one can have problems with anesthesia. The minor problems consist of headache, nausea, vomiting, or muscle soreness. However, there can also be some very serious problems with anesthesia that can, although rare, can lead to death. So there's also bleeding problems. During healing, complications with bleeding can occur. If the scab from one of the wounds is torn off, emergency surgery must occur to stop the bleeding. And also there's always a chance of infection. Your wounds can, it's rare, but it can lead to a more intensive treatment. And my brother had his tonsils taken out 2 summers ago, and he had I think hemorrhaging in his tonsils and had to have 2 emergency surgeries, which is like the worst of the worst. However, there are some success stories like me. When I was around 8 years old, I could barely breathe when I was sleeping. I had horrible night sleeps. I had to be propped up with 3 pillows, basically sitting when I was sleeping because I couldn't breathe. And after my tonsillectomy, I was able to breathe. I was able to sleep. I got sick a lot less. And so there's a success story with tonsillectomies. Yeah. Thanks.